neurological disorders, and we'll just do a brief overview on what they are and what ones we've been going over this month. But first, if you haven't already, please follow us on our Instagram. We also have our link tree on our Instagram, which has all of our presentations linked, and our YouTube channel and our website that is a work in progress. Yeah, sign up for our email list if you haven't already as well, because we have meetings twice a month usually, and then extra events sometimes. Like tonight after this meeting, we have our bracelet making events on campus. So join us from on Zoom for on campus at 8:15 if you'd like to be part of that. So as always, our usual disclaimer, none of what we're talking about today is medical advice. So if you're concerned about any of these issues for yourself, please talk to your doctor. And our guest speakers' experiences do not represent everyone with their condition. As we've talked about before, there's a spectrum to all of these disorders and conditions we're talking about. So there's a wide range of things that can be experienced. So today we're going to be focusing on multiple sclerosis, epilepsy, and neurological disorders and functional movement disorders. We have a guest speaker for each one of those tonight. So thank you so much for joining us. So brief overview, a neurological condition is a condition that affects the nervous system. So it can range from a genetic disorder to infections to head trauma. And there's a lot of various symptoms for all of these different neurological conditions. And I'm not going to list off all of them, but there are a lot of different neurological conditions. And that's why we break them down and focus on individual ones each month so we can learn a little bit more about each one of them. So some main takeaways from our presentation earlier this month, from our presentation on multiple sclerosis, functional neurological disorders, and epilepsy is neurological conditions are any conditions that affect the nervous system. So there's many conditions that fall under this umbrella, like we just looked at in the last slide. Multiple sclerosis is an autoimmune condition where the immune system attacks myelin sheaths that cover nerve fibers, which causes communication issues between nerves. And MS can also lead to permanent damage of the nerves. Epilepsy causes seizures, and seizures, epilepsy is not the only cause for seizures though, and seizures can be presented in a variety of ways, not just shaking and jerking around. And if someone is having a seizure, protect their head and call for help ASAP. If someone does have a seizure that is jerking around, we don't want them to hit their head or cause any further head trauma. So, and functional neurological disorders are conditions that have an abnormality in the brain functions without any structural damage that can be seen from like an MRI or anything like that. So, and final and most important point, always be kind to others. You never know what someone is dealing with, whatever that be, whether it be mentally, physically, or otherwise. We're all dealing with struggles, and some of us are dealing with chronic conditions that are not able to be seen. So today we have three guest speakers. We have Bethany and Maddie, who are both students at Loyola, and we have Michelle, who's a friend of Sarah's. So welcome. Thank you so much for taking the time out of your busy days to share your experiences with us. We really appreciate your insights. So if you guys want to do a little introduction or tell a fun fact or anything like that, that would be great.
I can go. I'm Bethany. I'm a senior creative ed major at Loyola, and I have FND, more specifically, a functional movement disorder. If anyone else wants to jump in, feel free.
I can go. Sorry about the background noise. Can't really control that. The fan is a nightmare, but I'm Maddie. I'm a sophomore here, bio major, and I have something called a catamenial epilepsy seizure disorder.
Hi, I'm Michelle. I have multiple sclerosis, and I am in the Delaware County area of Pennsylvania with Sarah. So that's, I guess, my introduction.
Awesome. Thank you, guys. Oh.
That's good. Continue.
No, continue. You want to talk about the first question?
Yeah. Okay. So what was your experience with your neurological condition, And what was it like getting diagnosed?
Yeah, any one of you can speak up. We'll just like kind of round table it and go around with answers.
I can go first. Or no, you go
Oh.
ahead. Sorry.
Okay. No, sorry. Yeah, so personally, like, no neurological conditions ever ran in my family, so it was really weird. I got diagnosed when I was 15, and that's when symptoms started coming on. And honestly, it was kind of a nightmare because some doctors just, they struggle with diagnoses, and patients struggle getting diagnosed. And what I have, catamenial epilepsy, has to do with my shift in hormones. So it's kind of hard to like show proof of that too. And sometimes seizures don't show up on EEGs. So it was definitely a really difficult process.
For me, I was diagnosed last April. I had a sudden onset of symptoms. For me, my movement disorder, it's just like tics with like my head, hands, feet, sometimes with my eyes. I have like a little eye scrunch. And getting diagnosed was a huge relief. A huge part of diagnosing FND is like once you figure out what it is, your symptoms and the severity kind of goes down a lot. And then I don't know, something that's interesting with FND is it's actually visual for me. Like I've never had a visual disability before, so that was a hard thing to get, adjusted to. And then also with this diagnosis, it's super isolating because like having a group sort of support group is advised or not advised by medical professionals, just because tics and other types of movements are super suggestible and can spread among patients. So it was a weird mix for sure.
Yeah. Yeah, people always think that getting diagnosed is often a heartbreaking thing, but for a lot of patients, it's actually kind of a joyous thing. Like, I finally know what the answer is. I know it's causing this problem for me.
Yeah.
In my situation, oh, go ahead, Stephanie. Sorry.
No, go ahead.
In my situation, a lot of people who are diagnosed with multiple sclerosis have gone on a long journey before they get to their diagnosis. So I've met many who have said that it's a relief to have a name, like Sarah was saying, that you have a name with what you've been struggling with. In my case, I feel like I was lucky because I got diagnosed so quickly. But I got diagnosed so quickly because the symptoms came on so quickly. I was experiencing something that I wasn't quite sure of in September, and by Veterans Day in November, I was diagnosed. So it was 2 months and a couple of weeks. So that's very quickly.
Yeah.
Is it like this year?
No,
No?
it was a very long time ago. No.
Okay.
Yeah, I didn't give years because it's been 23 years. So
Wow.
yeah, so it's much longer than you guys have been alive. So I figured like years is not as significant. I mean, it is in a lot of ways because of all the things that have changed as far as treatments that are available. The diagnoses methods are the same though, which is incredible that after 20 years that the same ways are available, that there's nothing new on that horizon. Like there's no like quick way I mean, there is a quick way, but it's not like there's a blood test or that's not out there. But my diagnosis was that they thought that there was some type of an infectious disease. So I had given all this blood to these infectious disease specialists, and then on the morning of Veterans Day, I woke up and within a couple hours was completely numb on one side of my body, and went to the ER, and was diagnosed the next day with multiple sclerosis. But yet the infectious disease doctor came in and said, okay, you have syphilis and we're going to start you on penicillin. And I'm like, I'm allergic to penicillin, and what are you talking about? So I was very glad that it was a false positive, because it was like, that's not what I wanted to hear. And it was also impossible, just because it was impossible. So that would have been like, we're talking like, miracle type thing of,
Yeah.
So getting the diagnosis of multiple sclerosis, confirmed, was a relief, but it also it was very helpful, in knowing in that short amount of time, like, this is what you're dealing with.
Yeah, for sure.
So what are your worst symptoms? And you guys generally shared when you started experiencing symptoms. And what helps your symptoms? What makes them worse? What makes them better?
I can go. The worst symptoms I have obviously are having seizures. Yeah, things that make them worse, definitely lack of sleep, a lot of stress, anxiety, and then personally for me, like hormone shifts, menstrual cycle sort of thing, which was kind of unique, and that was part of why it was difficult getting a diagnosis. Yeah.
About you, Bethany?
For me, the worst part of my symptoms, for whatever reason, my neurologist never really knew why. My tics are like triggered and sync up to noise randomly. So I'll be like on the L and I'll hear the guy talking on the L and I'll immediately just start ticking along with it. They were like, maybe that's because you played music a lot. We don't really know. The brain is a weird thing. And then also just like suppressing tics is so uncomfortable in a way that's hard to describe. So that's probably the worst part. And then kind of the same thing with symptoms being better when I'm like well rested, not stressed, and like to manage stuff, I'll do like meditation. And if noise is being too much, I'll step out of the room. And then another huge component of my diagnosis in particular was I was consuming a lot of tic and Tourette's related content online, and I didn't realize that that could have been harmful. Possibly like they're linking people consuming a lot of that type of content and like starting to develop tics. It's like a whole pandemic within a pandemic. There are articles out about it. Basically because I have another neurological condition, chronic migraine, and I didn't know that my brain was predisposed to developing tics. Watching a lot of that stuff was super suggestible and kind of initiated this diagnosis, which is unfortunate. So talking about tics and seeing other people tic, whether it's online or in person, is what makes things worse generally. So I like have to block any like hashtags with tics or Tourette's or anything. So it's definitely interesting and not well heard of. So yeah,
that definitely is an interesting component.
Mm-hmm.
What about you, Michelle?
The worst symptoms for me personally are fatigue, which is very, very different from being tired. Fatigue is more like you hit a brick wall and you can't move, or you feel like you're going to fall on the floor and not be able to get back up. So it's just a complete stop of everything. That type of tired. And then the other symptom that I struggle with a lot is the cognitive disability, and that's a big part of that has been speech. where I can't think of words, and memory is not as sharp for some things. Doesn't seem to be necessarily long-term or short-term, just certain things I struggle with more. And there are those things as well. Well rested seems to make things better. Also cooler temperatures. I get cold very easily though, so that makes it a little tough to find like the right temperature, because heat makes your symptoms in MS patients in general, makes you feel like your symptoms are heightened. So my symptoms will feel like I'm having some type of exacerbation in the heat. So like with our weather over the summer, it was difficult to be outside for any amount of time, because it was hard to walk. And I don't typically have issues walking short distances. So for me to walk a half block I felt like I had walked through the mud, and it was really difficult. But once I sat down in a cool room for 20 minutes, then I felt more comfortable and I was able to function again.
What treatments have you guys tried? What's worked? What hasn't worked?
I got started right away on medication. My first doctor was sort of like, we're going to put you on the basic dose of like one of the most common, which is Keppra for seizures, and then we'll just kind of go from there. And I didn't really like that pace because I didn't like the anticipation of, okay, well, maybe something's going to happen again. So I ended up seeing 2 more doctors, and then I went on the maximum dosage, and things have been really great from there. Yeah, that's pretty much the only treatment I could go through.
How about you, Bethany?
For me, you can take medication for FND, but they try to do it without. That's more like if you have a chronic sort of symptom with FND. So for me, I was initially supposed to be a part of Shirley Ryan Ability Lab's outpatient intensive rehab program for functional movement disorders, but there was like a huge wait list, so I couldn't get in there for 8 months. So I was kind of just dealing with symptoms. And so my team of doctors at Rush, they recommended a couple PTs, and they didn't really know what they were doing. So some of the things that didn't work is they had me do some like brain training exercises that were kind of crazy. They like strapped a light to my forehead, and I had head tics, so my head was moving all around. So they had me trying to control where this light was going on like a poster on the wall. And then that ended up triggering a migraine. So it just made my other neurological condition worse. And then at one point I had a neurologist try hypnosis, which was kind of crazy. That's something that's kind of in line with like meditation. And yeah, I did not see that doctor again. So I did not enjoy that. And then after those 8 months, I got into Shirley Ryan, and I like started receiving specialized care. So I was having neuropsych therapy alongside PT and OT, and that was 3 or 4 days that were like 4 to 6 hours long, where I was just focusing on reestablishing a normal movement pattern. And it was exhausting. I would kind of compare it to like what Eleven does during Stranger Things, where she was just focusing really, really hard, except instead of me crushing a can, it was me just trying to like hold a pencil and type and write again. They like exposed me to my triggers. So they would turn on like classroom noise. So I would do those activities. I walked up and down like the Michigan Avenue path or Lakeshore path that was near Shirley Ryan. And it was just kind of crazy. It was like a huge mental game, and like just kind of moving and reestablishing those normal motor plans. So really interesting. But yeah, that was kind of the treatment I went through.
That's awesome. They have that. I went through, not to bring it off topic about me, but I did Shirley Ryan's chronic pain program. So I understand what you're talking
They're
about.
awesome. Yeah, no, they're so great. I was there during Halloween, so they had like a bunch of fun celebrations. I was there with like it was like an open gym, so I was seeing a bunch of other people and like kind of figuring or like meeting people. It was like a really nice community. Yeah, I'm glad it was a good experience for you too.
Yeah, awesome. How about you, Maddie?
I already went Michelle.
Oh, see, okay,
It's
pot's
okay.
brain, it's fine.
That's okay. I've tried steroids. Steroids are kind of the fix for exacerbations because they reduce the inflammation very rapidly. So I've used IV steroids for that type of issue. And then I've tried a few of the different disease modifying treatments. I learned pretty early on when I first started, there were only 3 drugs available, and 2 of them were interferon based. And interferons were not a good treatment choice for me. They can cause depression, and they did cause severe depression in my case. I had to be hospitalized twice, once with the first interferon that I tried, and then again with a second interferon that was a different dosing regimen. It was part of a clinical trial. So we were hoping, my doctor and I and the clinical trial team, that because the dosage was both administered in a different way and a different overall amount, that it wouldn't have the same side effect, but it did. So I was not allowed to continue on that path. And then some years later, I would say probably maybe 15 years later, there was another trial. Like, I've done many clinical trials, but there was another trial for an oral medication rather than an injection that I'm currently taking, that is working, I think, very well. The progression has slowed, so that's a good sign. So I think those have been good, along with physical therapy and occupational therapy. But the PT and OT have been helpful in short amounts of time, for short amounts of time. So they're not a long-term fix. The things I learned to help me with in OT with cognitive things were helpful then, but over time, those skills are not retained, which is sad, because it's not. You would think that you learned that, so you would just know, but my brain functions differently as time goes on. So then I don't know. I remember the things that we talked about and that I did. I remember the exercises and all of that, but doesn't change that I can't use those skills. So it's unfortunate.
Yeah. And like you said, treatment with MS is especially important because it is a progressive disease. So catching it early and treating it early is very important. So what has your condition changed for you? Like, how has it changed your life, your social life, for those in school, your school life?
I was only 29. Come on now. And I was in school.
I mean, personally, for me, it changed everything. I was like, I'd never had a health issue before. I was like, head of the cross country team, straight A student and everything. And then like all of a sudden I was missing days of school, like weeks of school, and some friends were super understanding, some were not at all. And it just, yeah, it was like a completely new lifestyle I had to adjust to.
What about you, Bethany?
For me, it was like a huge social impact as well. When I noticed people were staring at me ticking, it made the tics worse. So I was sitting in class and like moving around, I could feel like these people just being like irritated with me for like, it looks like fidgeting. I've had a few professors like not really believe my symptoms. I was told I couldn't do the Shirley Ryan program. I ended up doing it anyways by one professor. Once he saw how bad the tics were, I couldn't even like type in class. And it was a huge distraction for myself and other people. So having to like advocate for myself, and then also just like a lot of my treatment since, well, I was first diagnosed when like COVID was going on, or like we were just coming out of it. So I had a lot of like family support at home. But here I was like taking myself to PT, going to OT. It was like a full-time job alongside school, which was really exhausting. But thankfully, I had some good friends here, which made things a lot better. But yeah, that's pretty much how it affected me.
What about you, Michelle?
It changed everything. I was going to school full time during the day and then working full time at night. I was a single mother. And my grandmother, she insisted that my son and I move in with her. Only, I think it was like within the year prior to me getting diagnosed, and it was because she wanted me to go back to school and finish my degree. And she said, I'll watch she would watch my son. That not to worry about that. She would take care of him after school, and I would be able to see him for dinner, and then I'd have to go to work. But it was very important. But trying to I had to withdraw that semester that I was diagnosed. But because I was going to graduate the next semester, my professors were very understanding and allowed me to not, they said, don't withdraw, that just, you can finish the work up in January. And they said, just take your time. We know where you are. So it was really enlightening that the teachers were that supportive. And it wasn't because I went to the college's disabilities department or anything like that. I didn't even know the school had one at that time. They just said it from their own. They said, because they knew what was going on, why I wasn't in class. So yeah, it was the most supportive that I could have imagined.
Yeah.
But it did slow me down a lot because I was, constantly on the go. Because my son was, I think 8, 7, something like that, maybe 7 at the time. So it was a much different thing. And so it ended up being that our lives changed. I focused much more, my focus changed to see that school was a temporary thing, and that trying to have a social life was just not in the picture while we were figuring all of that out. So
Yeah, that's very understandable, and I'm glad you had that experience with Professor. That's really refreshing to hear. So we have like 3 final questions, and then we'll open it up to anyone who has any additional questions. So in like a couple sentences, or like a few brief points, what advice would you give to someone who's newly diagnosed with your condition? Let's go.
I would just say, I always wanted someone to tell me that like things would get better, and I just realized that's kind of unrealistic. And risks. I wouldn't say it gets better, but it can become manageable. It just takes time, and you just have to be patient.
What about you, Bethany?
For me, I would probably again tell myself like a year ago that like just because it's neurological and no one else can see it, or like I don't know the exact cause. For me, you could see my stuff going on, but just because my doctors didn't know the exact cause, that it wasn't fake or I wasn't making things up. And for someone who's newly diagnosed, fndhope.org has a lot of great resources, so I'd probably direct them there.
What about you, Michelle?
I would, my first point of advice would be similar to Bethany's, to, if you're going to look something up, to use a reliable resource, not a broad search on the internet, because you're going to get back such ridiculous results.
Definitely. Probably very the case.
Yeah, you can get into a real deep hole on the internet really quickly. So again, in like a few brief points or sentences, if the public were to know one thing about your condition or neurological disorder, what would you want it to be?
I mean, I don't want to speak for everyone, but I feel like a lot of people can relate to the fact that just because you don't see it all the time doesn't mean that you're not still struggling with it and you're not still going through it as often as you are.
Absolutely.
For me, since TikTok kind of initiated things for me and a lot of other people across the country, it was kind of a lot of media coverage was like, these teenage girls are hysterical, they're making this up since, well, I don't know why, but people love to hate on teenage girls. So I would probably let the public know that it's not fake, and it's not a sort of mass hysteria, and to educate themselves a little bit more on the topic.
Definitely.
I don't want to jump in on, because I don't have this condition, so I don't want to claim, but at least from my perspective, a lot of people assume tics are always related to Tourette's, which they're not always. Can be related, but there are other causes as well.
Yeah,
exactly. That is huge.
What about you, Michelle?
I would want people to know that multiple sclerosis affects every facet of your life.
Oh, and similar, but a little bit different. If you just sum up in a couple points or sentences, if doctors were to know one thing about neurological conditions or your condition specifically, what would you want it to be?
I mean, for me, I feel like, I don't know, I think this could go for a lot of conditions too, but I feel like especially with the different epileptologists I've talked to, it's not like, I don't know, there's not one blanket diagnosis. Like, there's so many other factors that go into things that you have to look at every aspect of it.
Again, jump in with that. I don't have epilepsy, but there are lots of different types of epilepsy, and they all present differently. It's not just convulsions. It can present many different ways.
Sure. How about you, Bethany?
Just to know that FND exists and it's not like just all in your head. My migraine neurologist still refers to my FND as like, oh yeah, that like muscle spasm thing you have going on, and like has offered to, like, when I was in so much pain from tics, he was like, I can just like put Botox in your neck. You might not be able to hold your head up for like 6 to 12 weeks, but you wouldn't be in pain. I'm like, I mean, yeah, I wouldn't be in pain, but what?
Because that's totally realistic, right? Like, you
Yeah,
can totally function with that.
absolutely. So now I'm like, well, I don't really trust you anymore. So
That's
just kind of like reading up on it. Yeah.
Wow, I'm so sorry.
I mean, I was ready to take it. My mom thankfully stepped in. She was like, we're not going to do that. But yeah, it's crazy.
Wow. How about you, Michelle?
I think that I would want the doctors to know that I would much rather you help me manage my symptoms than make me prove them. That seems to be pretty common with hidden symptoms across the board for not just neurological. I haven't had that with my personal doctor, but I hear it all the time. So whether you're making it up or it's real to you. So it shouldn't be that you have to prove it and keep explaining it and keep, it's real.
Yeah.
Just, take my word for it. It's really happening. And that's kind of the thing I wish doctors would accept.
Definitely.
That's a huge important point for like every condition that we talk about in this club. Does anyone on Zoom or anyone in person have any questions for any specific speakers or any questions overall on anything? Feel free to type it in the chat or speak up now. I'll mute myself.
Anyone on the Zoom have any questions? Feel free to speak up or put it in the chat, whichever is most comfortable for you. We have Claire saying that they don't have any questions, but thank you all for sharing.
Yes, thank you so much for taking your time to share your experiences with us. I have one question. It's kind of general for everyone if you'd like to answer it. This is a question that I get posed from my family a lot. It's like, if you could get rid of your conditions, would you? Like, if there was a cure, would you want it to be totally gone? Or is there some aspect that you want to keep? I know that's like a weird question, but I personally feel like my conditions have made me who I am, and not totally, but like it's a big part of me being an advocate for other people with disabilities and chronic conditions. And if I didn't have them myself originally, I don't know if I'd be doing what I'm doing now. Just for fun, if you don't have to.
I totally agree with that. I do. It's just like there were some days, especially like early on when I was having seizures and still like coming to terms with it, that I was like, I'd rather just keep like the good stuff and like the new personality traits and stuff that I've gotten and like just never have a seizure again. But like you said, like it's good. I feel like I have enough experience to like sort of educate and be an advocate for people that I guess, I don't know, I'll take it.
I kind of agree. Like if I could keep the character growth, but lose the debilitating aspects of things, that would be lovely. But I don't know. It's weird, especially since I got diagnosed when I was like 21. So I had like lived 21 years without having that before. So I'm kind of always comparing how I feel now to how I felt before. But I don't know. I really like my team of doctors and the community that I've built with them. So I don't know. I would probably keep what I have going on, especially since now I finally have it under control. That's a huge component. If you asked me that a year ago, I would have said to get rid of it.
Totally understandable.
I would say that all of you are saying very similar things about the amount of sensitivity you have learned of other people and what their situations are, regardless of their situations. And that's something that I think until you've gone through it, you can't imagine what it's like for another person. And there's still parts of the things that I've had to give up, like working, for example, that it's been 12 years, almost 13, since I've been able to work my full-time job, and I still miss it, and I still grieve the loss. So there's things about it that you just don't foresee, and it's not like I didn't foresee it could happen eventually, but I was doing so well, and but you just don't know. But I don't think I would take I don't think it's possible to say I would not have the illness, because it just happens when things happen. And you learn to accept it, and you have to learn to do things differently. And those differences are, exactly what all of you are saying. It's it makes you who you are.
Yeah.
It makes you good advocates.
Well, thank you so much to all of you for joining us.
Very much.
I did have a question actually for Bethany, because we share a similar other neurological problem of migraine. And I do get Botox for my migraines. And I don't know if they'd ever suggested that for you.
Yeah, that's like the one thing I haven't tried. Right now, I'm on, I think, 6 medications. The one major one that's like an injection is Emgality, and it's like every month you take a shot, and it blocks certain chemicals in your brain. I don't really know. It's a CGRP medication. But that was life-changing. If I had that when I was in middle school, which they aren't giving it to pediatric patients right now, hopefully in the future. But if I had that earlier on, it would have been probably just as effective as Botox. I'm glad that has it worked out for you?
It has. It's worked out very well. Migraines are something I had dealt with before, but only it was so infrequent, so it wasn't any issue. But as a side effect of my MS medicine, headaches can happen. And because I was a migraine sufferer before, it wasn't a headache that I got, it was a migraine. So then the migraines became like multiple daily. So when it got to that point, it's like, yeah, I have to do something. So tried different medications and got to a point where there was just nothing that was helpful.
Mm-hmm.
So
having the migraine brain fog on top of the MS brain fog must have been horrible. I'm sorry that you had to go through that.
Yeah, it was just like another layer of things, like, oh, look, here's the medicine you can finally take. And then it was, oh yeah, by the way, you might have a headache. It's like,
yeah,
but
I swear
I'm glad that they didn't tell me that before they gave it to me to take, because I think that would have been, I would have wondered if that was really happening, or was it just because they mentioned the side effect. But I didn't know that your brain can be kind of predisposed to that suggestibility of something, like you were saying. And I don't know if it's only in your condition or in general, or.
I have no idea. They say that for FND in particular, and a lot of the stuff, a lot of the answers I got from people were, we just don't know. The brain is hard to like explain all of the crazy things that go on.
Mm-hmm. I was interrupting. There's not that much research on FND because it's, rarely known about. So
yeah, I was a part of the research done by Rush. I was one of the patients included in their research for the new people that were brought on because of the TikTok ticks. So I'm kind of looking forward to the research that will be published in the future for sure.
Yeah, that's super interesting. I didn't even think about that. Well, yeah. Well, if no one else has any other questions, yeah, thank you guys so much for joining us tonight. So we are, just a quick announcement, we are looking for new board members for next academic school year. So if you're interested in potentially being on our board, you could scan the QR code and fill out the application. We're going to have the applications open until about January 5th. And from there we'll decide like if we would like to interview you and see where you could best fit on our team. We have a lot of positions open because a lot of our board is currently seniors, so we'd love to have you on. Any other announcements, Sarah?
Nope, just follow us again.
Yeah, yeah, follow us if you haven't already, and we have all of our information on our link tree, which will you'll get to from the QR code. So thank you all for joining us over Zoom. If you'd like to join us in person, we are starting our bracelet event now. And yeah, thank you so much to our guest speakers. Thank you for giving up your time to talk to us tonight. We really appreciate it.